Hi, and welcome viewers of Nursing Academy 101. In this video, we'll talk about Pediatric Nursing Multiple Choice Questions and Answers Part 1. But before the show, please don't forget to subscribe, like, and share the channel to encourage us to continue and provide you with all new. Question number 1. A nurse in a delivery room is assisting with the delivery of a newborn infant. After the delivery, the nurse prepares to prevent heat loss in the newborn resulting from evaporation by A. Warming the grip pad. B. Turning on the overhead radiant warmer. C. Closing the doors to the room. D. Drying the infant in a warmer blanket. The answer is D. Drying the infant in a warm blanket. Evaporation of moisture from a wet body dissipates heat along with the moisture. Keeping the newborn dry by drying the wet newborn infant will prevent hypothermia via evaporation. Question number 2. A nurse is assessing a newborn infant following circumcision and note that the circumcised area is red with a small amount of bloody drainage. Which of the following nursing actions would be most appropriate? A. Document the finding. B. Contact the physician. C. Circle the amount of bloody drainage on the dressing and reassess in 30 minutes. D. Reinforce the dressing. The answer is A. Document the findings. The penis is normally red during the healing process. A yellow exudate may be noted in 24 hours, and this is a part of normal healing. The nurse would expect that the area would be red with a small amount of bloody drainage. If the bleeding is excessive, the nurse would apply gentle pressure with sterile gauze. If bleeding is not controlled, then the blood vessel may need to be ligated, and the nurse would contact the physician because the findings identified in the question are normal, and the nurse would document the assessment. Question number 3. A nurse in the newborn nursery is monitoring a preterm newborn infant for respiratory distress syndrome. Which assessment signs, if noted in the newborn infant, would alert the nurse to the possibility of this syndrome? A. Hypotension and bradycardia. B. Tachypnea and retractions. C. Acrocyanosis and grunting. D. The presence of barrel chest with grunting. The answer is B. Tachypnea and retractions. The infant with respiratory distress syndrome may present with signs of cyanosis, tachypnea, or apnea. Question number 4. A nurse in a newborn nursery is performing an assessment of a newborn infant. The nurse is preparing to measure the head circumference of the infant. The nurse would most appropriately A. Wrap the tape measure around the infant's head and measure just above the eyebrow. B. Place the tape measure under the infant's head at the base of the skull and wrap around to the front just above the eyes. C. Place the tape measure under the infant's head, wrap around the occiput, and measure just above the eyes. D. Place the tape measure at the back of the infant's head, wrap around across the ears, and measure across the infant's mouth. The answer is C. Place the tape measure under the infant's head, wrap around the occiput, and measure just above the eye. To measure the head circumference, the nurse should place the tape measures under the infant's head, wrap the tape around the occiput, and measure just above the eyebrows so that the largest area of the occiput is included. Question number 5. A postpartum nurse is providing instructions to the mother of a newborn infant with hyperbilirubinemia who is being breastfed. The nurse provides which most appropriate instructions to the mother? A. Switch to bottle feeding the baby for 2 weeks. B. Stop the breastfeedings and switch to bottle feedings permanently. C. Feed the newborn infant less frequently. D. Continue to breastfeed every 2 to 4 hours. The answer is D. Continue to breastfeed every 2 to 4 hours. Breastfeeding should be initiated within 2 hours after birth and every 2 to 4 hours thereafter. The other options are not necessary. Question number 6. A nurse on the newborn nursery floor is caring for a neonate. On assessment, the infant is exhibiting signs of cyanosis, tachypnea, nasal flaring, and grunting. Respiratory distress syndrome is diagnosed, and the physician prescribes surfactants replacement therapy. The nurse would prepare to administer this therapy by A. Subcutaneous injection, B. Intravenous injection, C. Installation of the preparation into the lungs through an endotracheal tube, D. Intramuscular injection. The answer is C. Installation of the preparation into the lungs through an endotracheal tube. The aim of therapy in RDS is to support the disease until the disease runs its course with the subsequent development of surfactant. The infant may benefit from surfactant replacement therapy. Question number 7. A nurse is assessing a newborn infant who was born to a mother who is addicted to drugs. Which of the following assessment findings would the nurse expect to note during the assessment of this newborn? A. Sleepiness. B. Cuddles when being held. C. Lethargy. D. Incessant crying. The answer is D. Incessant crying. A new infant born to a woman using drug is irritable. The infant is overloaded easily by sensory stimulation. The infant may cry incessantly and posture rather than cuddle when being held. Question number 8. A nurse prepares to administer a vitamin K injection to a newborn infant. The mother asks the nurse why her newborn infant needs the injection. The best response by the nurse would be A. Your infant needs vitamin K to develop immunity. B. The vitamin K will protect your infant from being jaundiced. C. Newborn infants are deficient in vitamin K and this injection prevents your infant from abnormal bleeding. D. Newborn infants have sterile bowels and vitamin K promotes the growth of bacteria in the bowel. The answer is C. Newborn infants are deficient in vitamin K and this injection prevents your infant from abnormal bleeding. Vitamin K is necessary for the body to synthesize coagulation factors. Vitamin K is administered to the newborn infant to prevent abnormal bleeding. Newborn infants are vitamin K deficient because the bowel doesn't have the bacteria necessary for synthesizing fat-soluble vitamin K. The infant's bowel doesn't have support the production of vitamin K until the bacteria adequately colonized it by. Question number 9. A nurse in a newborn nursery receives a phone call to prepare for the admission of a 43-week gestation newborn with Apgar score of 1 and 4. In planning for the admission of this infant, the nurse's high priority should be to A. Connect the station back to the oxygen outlet. B. Turn on the apnea and cardiorespiratory monitor. C. Set up the intravenous line with 5% dextrose in water. D. Set the radiance warmer control temperature at 36.5 degrees Celsius, 97.6 degrees Fahrenheit. The answer is A. Connect the station back to the oxygen outlet. The highest priority on admission to the nursery for a newborn with low Apgar score is airway, which would involve preparing respiratory resuscitation equipment. The other options are also important, also they are of lower priority. Question number 10. Vitamin K is prescribed for a neonate. A nurse prepares to administer the medication in which muscle site? A. Deltoid. B. Triceps. C. Vestus lateralis. D. Biceps. The answer is C. Vestus lateralis. Question number 11. A nursing instructor asks a nursing student to describe the procedure for administering erythromycin ointment into the eyes of a neonate. The instructor determined that the student needs to research this procedure further if the student states A. I will clean the neonate's eyes before installing ointment. B. I will flush the eyes after installing the ointment. C. I will instill the eye ointment into each of the neonate's conjunctival sacs within 1 hour after birth. D. Administration of the eye ointment may be delayed until an hour or so after birth so that eye contact and parent-infant attachment and bonding can occur. The answer is B. I will flush the eyes after installing the ointment. Eye prophylaxis protects the neonates against Neisseria, gonorrhea, and chlamydia trachomatis. The eyes are not flushed after installing of the medications because the flush will wash away the administered medication. Question number 12. A baby is born precipitously in the ER. The nurse initiate action should be to A. Establish an airway for the baby. B. Ascertain the condition of the fundus. C. Quickly tie and cut the umbilical cord. D. Move mother and baby to the birthing unit. The answer is A. Establish an airway for the baby. The nurse should position the baby with head lower than chest and rub the infant back to stimulate crying to promote oxygenation. There is no haste in cutting the cord. Question number 13. The primary critical observation for Apgar scoring is the A. Heart rate. B. Respiratory rate. C. Presence of meconium. D. Evaluation of the Moro reflex. The answer is A. Heart rate. The heart rate is vital for life and is the most critical observation in Apgar scoring. Respiratory effects rather than rate is included in the Apgar score. The rate is very erratic. Question number 14. When performing a newborn assessment, the nurse should measure the vital signs in the following sequence. A. Pulse, respirations, temperature. B. Temperature, pulse, respiration. C. Respirations, temperature, pulse. D. Respiration, pulse, temperature. The answer is D. Respirations, pulse, temperature. The sequence is least disturbing. Touching with the stethoscope and inserting the thermometer increase anxiety and elevate vital signs. Question number 15. Within 3 minutes after birth, the normal heart rate of the infant may range between A. 100 and 180, B. 130 and 170, C. 120 and 160, D. 100 and 130. The answer is C. 120 and 160. The heart rate varies with activity. Crying will increase the rate, whereas deep sleep will lower it. A rate between 120 and 160 is expected. Question number 16. The expected respiratory rate of a neonate within 3 minutes of birth may be as high as A. 50, B. 60, C. 80, D. 100. The answer is B. 60. The respiratory rate is associated with activity and can be as rapid as 60 breaths per minute. Over 60 breaths per minute are considered tachypnea in the infant. Question number 17. The nurse is aware that a healthy newborn's respirations are A. Regular abdominal 40 to 50 per minute deep, B. Irregular abdominal 30 to 60 per minute shallow, C. Irregular initiated by chest wall 30 to 60 per minute deep, D. Regular initiated by the chest wall 40 to 60 per minute shallow. The answer is B. Irregular abdominal 30 to 60 per minute shallow. Normally, the newborn's breathing is abdominal and irregular in depth and rhythm. The rate ranges from 30 to 60 breaths per minute. Question number 18. To help limit the development of hyperbilirubinemia in the neonate, the plan of care should include A. Monitoring for the passage of meconium each shift, B. Instituting phototherapy for 30 minutes every 6 hours, C. Substituting breastfeeding for formula during the second day after birth, D. Supplementing breastfeeding with glucose water during the first 24 hours. The answer is A. Monitoring for the passage of meconium each shift. Bilirubin is excreted via the GI tract. If meconium is retained, the bilirubin is reabsorbed. Question number 19. A newborn has small whitish pinpoint spots over the nose, which the nurse knows are caused by retained subaqueous secretions. When charting this observation, the nurse identifies it as A. Milia, B. Lanigo, C. Whiteheads, D. Mongolian spots. The answer is A. Milia. Milia occur commonly, are not indicative of any illness, and eventually disappear. Question number 20. When newborns have been on formula for 36 to 48 hours, they should have A. Screening for PKU, B. Vitamin K injection, C. Test for necrotizing enterocolitis, D. Hill stick for blood glucose level. The answer is A. Screening for PKU. By now, the newborn will have ingested an ample amount of the amino acid phenylalanine, which, if not metabolized because of a lack of the liver enzyme, can deposit injurious metabolites into the bloodstream and brain. Early detection can determine if the liver enzyme is absent. Question number 21. The nurse decides on a teaching plan for a new mother and her infant. The plan should include A. Discussing the matter with her in a non-threatening manner, B. Showing by example and explanation how to care for the infant, C. Setting up a schedule for teaching the mother how to care for her baby. D. Supplying the emotional support to the mother and encouraging her independence. The answer is B. Showing by example and explanation how to care for the infant. Teaching the mother by example is a non-threatening approach that allows her to proceed at her own pace. Question number 22. Which action best explains the main role of surfactants in the neonate? A. Assist with ciliary body maturations in the upper airways. B. Helps maintain a rhythmic breathing pattern. C. Promotes clearing mucus from the respiratory tract. D. Helps the lungs remain expanded after the initiation of breathing. The answer is D. Help the lungs remain expanded after the initiation of breathing. Surfactant works by reducing surface tension in the lung. Surfactant allows the lungs to remain slightly expanded, decreasing the amount of work required for inspiration. Question number 23. While assessing a 2-hour-old neonate, the nurse observed the neonate to have acrocyanosis. Which of the following nursing actions should be performed initially? A. Activate the code blue or emergency system. B. Do nothing because acrocyanosis is normal in the neonate. C. Immediately take the newborn's temperature according to hospital policy. D. Notify the physician of the need for a cardiac consult. The answer is B. Do nothing because acrocyanosis is normal in the neonate. Acrocyanosis or bluish discoloration of the hands and feet in the neonate, also called peripheral cyanosis, is a normal finding and shouldn't last more than 24 hours after birth. Question number 24. The nurse is aware that a neonate of a mother with diabetes is at risk for what complication? A. Anemia. B. Hypoglycemia. C. Nitrogen loss. D. Thrombosis. The answer is B. Hypoglycemia. Neonates of mothers with diabetes are at risk for hypoglycemia due to increased insulin level. During gestation, an increased amount of glucose is transferred to the fetus across the placenta. The neonate liver cannot initially adjust to the changing glucose level after birth. This may result in an overabundance of insulin in the neonate, resulting in hyperglycemia. Question number 25. A client with group AB blood whose husband has group O has just given birth. The major sign of ABO blood incompatibility in the neonate is which complication or test result? A. Negative COMP test. B. Bleeding from the nose and ear. C. Jaundice after the first 24 hours of life. D. Jaundice within the first 24 hours of life. The answer is D. Jaundice within the first 24 hours of life. The neonate with ABO blood incompatibility with its mother will have jaundice pathologic within the first 24 hours of life. The neonate would have a positive COMS test result.